Hello there. My name's Bree Laughlin, and I am from Nurse Disrupted. This is your virtual volunteer training webinar. Thank you so much for volunteering your time. Today, we're going to take about an hour, and I want to go over a few things. We're going to talk about how Nurse Disrupted got started, who we are, and talk about our community partners. And then I want to prepare you for volunteering. We'll do a high-level overview of workflows, requirements to be a volunteer for our program, tools you're going to need to use, and then next steps to get you up and going in volunteering. So a little background, that's me, Bree Laughlin. I started my nursing career off 22 years ago in Seattle. So I spent a lot of time at the bedside, primarily in kidney and liver transplant, but also med-surg. With me is Tracy Zvinyich, co-founder of Nurse Disrupted. Also started her career off 17 years ago. She has a background in ICU. Years went by. We got advanced degrees in nursing. We both took executive roles for larger corporate companies. And then just recently started Nurse Disrupted in response to the COVID-19 pandemic. A little bit more about that right here. So for many of us, our lives are forever changed because of the pandemic. That's true of us. March 23rd, my family and I were supposed to be on spring break back in Seattle. And of course, that wasn't going to happen. We're based in Madison, Wisconsin, for those of you volunteering from other places around the US. Based in Madison, Wisconsin. So March 23rd, we were on vacation, and my daughter and I were talking about just pitching in. We're nurses. This is the time for us to step up to the plate. And so I connected with Porch Light, which is an adult male shelter here in Madison, Wisconsin. I also met Carla Thins, who is the executive director for Porch Light. And she communicated that also what was needed for Porch Light was COVID-19 screening. They had medical volunteers. I very much wanted to do this, but I had some restrictions, and because of those restrictions of not being able to be there in person, I thought, well, there's got to be a way for us to be able to still provide screening. So if you didn't see, my past 8.5 years of my nursing career has been as a nurse executive for a software company called Epic. So I'm a tech nerd and a nurse. And I thought, well, if we need to get this screening done, I can create a virtual medium for the screening. And so with 2 donated tablets and a MiFi, in 48 hours, we were able to pop up a screening clinic. Now also, not just the technology and knowing evidence-based workflows or being able to do that research, this also took great friends. And in this photo, you actually see my godmother, who is also a nurse. She volunteers from Bend, Oregon. You see my friend Tracy, who I had called on Monday with this idea. In the middle, you see a trailer. So the state government had been working with our homeless shelter resources and how to do COVID-19 screening, but also to create physical distancing. The place that the screening takes place is actually in a trailer where we can separate people for more in-depth screening. So a little bit of technology, really great friends, resources from the state, and incredible leadership from Porch Light was kind of the magic combination that allowed us to bring this screening program live in 48 hours. The reason I share that with you too is that in response to the pandemic, things have moved quickly. Typically, as nurses, we are more methodical in creating our evidence-based practice. As you volunteer with us, we really are looking for your feedback because we've had to respond quickly and things change quickly, and we'll be working together to apply the best evidence-based practice that we can in this program. Okay, so Who are we? Well, we started off as a virtual volunteer program that popped up in 48 hours in response to the COVID-19 pandemic. The screening happens for homeless populations seeking shelter. The issue that we were trying to help resolve is that there was a process in place with community resources procured by the state, but there was a slice of that process that didn't quite work out for this homeless population, and it had to do with applying the protocol. And the protocol decides three things. You're going to help in-person volunteers decide if the sheltered guest can go to the shelter just fine, if they need to utilize a state procured hotel program, or if they need to go to the emergency department. And so the virtual volunteer program was able to serve this kind of missing spot, which is to apply the evidence-based protocol that helps with those three decisions. Now, speaking of good friends, Monday the 23rd, Tracy and I also serve on elected positions for the Wisconsin Nurses Association. We brought the idea to the association, and another one of our colleagues is also the dean of Marian University. And Kim Udlis's idea was, well, there were all these nursing students that were not going to graduate. Could we use the virtual volunteer program as practicum hours? And that's exactly what we've been able to do. So we started off with nurse practitioner students, nurses completing their doctoral degree and providing COVID-19 screening, and that has counted for their practicum hours. There's another arm of this. And so what the virtual volunteer program became is an arm to complete the screening for homeless populations, a resource for practicum hours to get our nurses graduated. And then the third thing that we saw is that we're able to ease the burden on our hospital systems. So whereas without the protocol, our sheltered guests would have to go to the ED for a lot of reasons, because of the hours that they're checking in, lack of resources, that we're able to make sure that they go to the appropriate place instead of everyone going to the emergency department when we really need those to be allocated for people who have severe symptoms. Okay, our partner organizations. Right now we are live only in Dane County. That's right in the heart of Madison, Wisconsin, some surrounding areas. And as you have heard, Porch Light is the first organization that we partnered with. They offer overnight shelter for adult male populations. And that starts at 5 p.m. at night, and then they stay overnight until 7 a.m. Our screening happens, so you would sign up for volunteer shifts between 4 p.m. and 8:30 p.m. The next location is the Salvation Army. They offer shelter services 24/7, and this is for adult female population. And so our screening happens then between 3 p.m. and 5:30 p.m. Of note, we will screen a couple of families. And so I do like to put that on the radar. Some people really love the opportunity to connect with kiddos. Some people, that's not something that they want. So know that although the majority of the people that will be screening will be adult single female population, that there will be a couple of kids and some additional training that's required because of that. Two other big important players in the Dane County homeless community services include the Beacon. Sorry. So this is a day shelter program, and although we're not providing screening there yet, we do collaboration with them, and the sheltered guests will come often from the Beacon programs. They also run the shelter service that brings many of the clients to the Warner Park Porch Light location for overnight shelter. Public Health of Madison and Dane County. So, of course, this is our Dane County Public Health arm. They do a lot in regards to protocols. And also, when we talk about those state resources that have been allocated, you saw the trailer that allowed us to create better distance. The Warner Park location for Porch Light shelters also was procured by the state to create the ability for social distancing and those 6 feet requirements for keeping everyone safe. But the other resource that the state procured were hotels. So if someone is symptomatic, they don't necessarily have to go to the hospital, but we do need to have that 14-day quarantine. There are nurses and staff when someone goes to the hotel voucher program that are working with those clients, and that those services are provided by Public Health of Madison and Dane County. Things change fast. I'm sure you see on the news that more information seems to come down the pike daily. And part of what we do as Nurse Disrupted is we keep our eyes to the current evidence base. We keep our eyes to the CDC, World Health Organization, and Wisconsin Department of Health. And we make sure that our practices are updated in relationship to, what the latest scientific evidence base is. So starting May 18th, based on new recommendations for homeless populations, our processes will be changing. We will begin universal screening for all staff and volunteers, whereas we were simply screening people seeking shelter for the night prior. Originally in Porch Light, the way the workflow went is that medical volunteers would ask what began as 3 preliminary questions, evolved into 5 questions, again, based on the evidence base. And the nursing volunteers would only conduct the more in-depth evidence-based screening. We will be doing both the preliminary screening as well as the in-depth screening moving forward. So, workflows. Right now are a little bit different between the 2 locations that we are live in, but those are going to become more consistent. So at the Porch Light virtual volunteer program, you will, from your laptop, sign into your computer, and there will be a tablet in the trailer at the Warner Park location for Porch Light Shelter Services. Now, at the beginning of the shift, people who are seeking shelter line up outside the Warner Park location. Porch Light has in-person volunteers and also the Beacon, as they're bringing people in from sheltered services or from their program, you have staff from the Beacon there as well. Currently, we have a Porch Light volunteer asking the 5 initial questions. We'll talk about that. And then the virtual volunteer, you will be available for when somebody says yes to one of those 5 questions. They'll be brought into a trailer. You saw that trailer earlier in the training video. They'll sit down at a tablet, and then you'll be on the other end. There will be an in-person volunteer there, because based on the protocol, again, 3 decisions. 1, they can go back to the shelter. 2, they need to go to the hotel, or 3, they need to go to the ED. The in-person volunteer has the paperwork and the phone numbers to get the client transferred to the appropriate resource, be it, again, shelter, ED, or the Quality Inn hotel. Also, your in-person volunteer is going to use a temporal thermometer. You'll do training and coaching and make sure that you see that that's being used appropriately. So again, protocol, truly we're making 3 decisions. I have here a little terrible drawing that I made to give you an idea of the physical layout of what's happening here at Warner Park. So what you see is shuttles come in. Some people come by way of their own transportation as well, but shuttles are dropped off. Our medical volunteers, as the clients are waiting to be let into the shelter, are asking those first 5 screening questions. To the side here, there's a grassy area, and there's that trailer you saw the photo of. And in that trailer is a tablet, and that's where, when the client comes in, you will actually be seeing them and asking the questions. When the process changes, there will be a tablet on wheels. There will be 2 of you volunteering. The first nurse will be asking the first 5 preliminary questions instead of lay volunteers. And then if the answer is yes, then the second nursing volunteer will ask the more in-depth questions in the trailer. Salvation Army is a little bit of a different workflow. Again, we're doing the COVID-19 screening per protocol, but here, instead of just coming in at nighttime, the guests are staying throughout the day. It's a 24/7 shelter services, focusing on adult women, like I said, families. There's a couple of families that are there. And we have the 2 tablets set up right out of the gate. The first volunteer will ask the 5 preliminary screening questions. If the answer is yes, they're taken to a second location. The second volunteer will then apply the more in-depth protocol. Same decisions. Where is it they're going? Either back to the shelter is fine, that they need to transfer a hotel or transfer to the ED. Same, there's an in-person volunteer there to initiate the protocol and to take the physical temperature. And this is more of a drawing. I'm not an artist, but here's more of a drawing of the way that this looks. So we have our clients coming in from a gymnasium where it is they stay. There's a reception desk with the tablet one. So the first 5 questions will be asked by the first volunteer here. If the answer is yes, they'll go into another office that has a closed door. And this is where you have your in-person volunteer with more PPE on, temperature will be measured. And then if they do go to the hotel or to the ED, there's an exit here where transportation will be arranged, and then they'll go to the appropriate place. Requirements. You have already signed up for the webinar. So you have likely already been to our volunteer website, and some of your requirements you've been uploading. One of the requirements, of course, is to complete this webinar training. There's paperwork there's general paperwork that you started filling out on the volunteer site, but Porch Light and Salvation Army also has paperwork, a little bit different paperwork. I'd love to encourage people to start their Salvation Army paperwork right off the bat, because there's a little bit more to get you through the finish line than Porch Light that just has a confidentiality agreement. But that is on the volunteer website. We're happy to help you through it if you have any questions. Other requirements is that you need a device, a laptop or a computer that has this camera. You need a fast enough internet connection to where you have a steady video feed by way of Zoom, and you need a private, quiet place. So remember, we are screening people. Some of the questions are sensitive. I'm homeschooling my kiddo now, like lots of us are. You need a place where you can have some peace and privacy. Internet connection, private, quiet place, covered that, okay. Show up on time and stay for the entire shift. We need you, and we need you for the entire time that the shift is allocated. You'll be doing in-person training and support. Now, the volume of the screening initially at Porch Light is pretty low. We had some 4-hour shifts where there would be anywhere from 0 to 4 clients that we would screen. Even if there's low volume, it's so important that you're there until the very last minute. We've had our sickest clients come in right at 8:29. Beyond 8:30, when the doors close at, for instance, Porch Light, no one else is coming in. But truly, we need you for the entire duration of this shift. And you learn a lot. I mean, you work with the in-person volunteers. A lot of kind of the process improvement stuff we're doing is in collaboration with people who are there in person. So there is a lot of value, even if some of the shifts, it's lower volume. And protocols, boy, I have loved working with so many nurses from different backgrounds, and we really do have diverse experience. The hardest thing, I think, about this process is that you must only apply the COVID-19 protocol for this service. Someday, maybe we'll be able to do more, but because of the emergent nature of this need and how quickly we popped up these services. As far as liability and what we may do is only and precisely applying the COVID-19 protocol that you'll be using for screening. And it's okay. I mean, I volunteer as well. And I've had people come and say, I have a migraine, or they want to talk about other things. And compassion, I want to talk a lot about compassion. Compassion is a big part of it, not just for the clients, but for the in-person volunteers as well. People are frightened. Something that we do well as nurses is just, alleviate some of the stress and the pressure. But when I have someone coming, to me and originally, we're doing the COVID-19 screening and they say something else, and I say, oh, I'm sorry, that you're feeling that. I am here to do COVID-19 screening. That's all that I can do for you today. But everyone, don't devalue that. It is really an incredible thing that you're doing and something that's very needed. So you must only apply the COVID-19 protocol. Everyone's been very understanding that is why we're here, and that is only and precisely what we can do in this role. Okay, I hope I communicated that well. It's important. We can only apply the protocol. We cannot use the full scope of our nursing licenses, if you're licensed. I know I have my retired nurses too. Jerry's one of them. So, the two criteria for volunteering is either you have a minimum bachelor's degree in nursing or you have an active RN license. We have now our students coming on that are doing their RN to BSN, and we're just so thrilled to have you. Okay, code of conduct. Seems like common sense, but we've got to cover them, right? No chemicals. You show up sober. You communicate with compassion and respect. And I love to talk about making sure your cup is full. There's a lot going on in our lives. It's important that we maintain compassion, but we have to have a full cup ourselves. So if you find that you're being stretched, communicate with us early so we can get a backup volunteer for you. Give yourself permission to excuse yourself from shifts if your cup is not full, because we really believe in providing that compassion to our in-person volunteers as well as the people that we're screening. So check in with yourself. Nursing wellness is absolutely a priority for our organization, and communicate with us if you need backup. Be receptive to feedback. So I'll tell you, I am looking forward to your feedback. And that's going to help us really evolve this program to be as effective as possible in helping our community members. We hope that you will be open to feedback as well, because again, we're learning on the fly. We ask for feedback from our shelters, and we ask for your feedback both with us and in regards to the shelters as well, so that we can continually improve. But hopefully that's with just an open heart. No discussion of political or religious views. We're talking to everybody from all walks of life, and we're coming together to do something better. And so that is a professional code of conduct. We have zero tolerance for racism, sexism, homophobia, xenophobia, and hate in general. If the above is discovered, you will be removed from the virtual volunteer program. We're a compassion-driven organization. And we provide care and compassion for everyone. And statements are limited to the adherence of care protocols for the betterment of all. Preceptorship. So some of you are volunteering to meet your practicum hours. And this is true even if you're just volunteering in general. We need your feedback. And it's not just the clients that we're engaging with, although I really love being able to communicate or connect with our community members, but on the process, what you see. So some of the feedback that was so helpful early on is, one of the early nights we activated the hotel protocol for one of our clients, and the number that we called, the person said, no, we're not going to take the client, and the protocol was acted on appropriately. The decision point had a little bit of a hiccup, but the great thing is that if we know that and we get that feedback from you, we're collaborating as a community here in Dane County. And so we were able to work directly with the Salvation Army and make sure the appropriate education was out there as far as, how the hotel voucher protocol was enacted and who qualified for it. Another night we had issues with transportation. People were waiting 1 to 2 hours to get the transportation set up. But when we have that feedback, the state resources have been great and our community resources have been great. And when they know about these gaps, we're able to fill them. PPE education. Boy, that's one with looking through that video and our in-person volunteers, we realized we needed to provide PPE education. We have people with no medical backgrounds that are coming in and volunteering. And so, again, your feedback is helping to build this program. And we really look forward to it. And this training process, I mean, we've been building this on the fly. What could be better? Please give us all of the feedback you can, because again, we've moved so fast and we're doing so much and things change. And when we hear from you, even about this training process, the software that you're engaging with, all of that feedback is so valuable in making this a meaningful program for our community. Tools. There are tools, and we're going to send these in communication, and we'll cover some of these today. That protocol that we're working to, it does change. And I'm going to say it again and again. Look for those updates in your email. Be prepared to be on your shift early to really look at the protocol changes. But we do have a nice overview document. I like to keep the overview document printed out when I do screening, but depending on your technology setup, do what works for you. But this overview gives you this higher picture of the protocol that we're applying. Then there is a documentation tool, and we'll cover that a little bit. So as you're doing the screening questions, you are putting down the client's responses, and it documents where the client goes. Please know PHI in this documentation. It is not an electronic health record. It is not encrypted. We need no identifiers. We're just making a tool to make the protocol a little bit easier for you to navigate. And two, we do get to see those outcomes and see, the impact of our program. And there's a practice tool for you can click through it as much as you want. You can practice, but then there's a live tool. And we ask that you not practice on the live tool. Okay, it's not the end of the world, but life is a lot easier if you use the practice tool for the practice and the live tool for when you have a volunteer shift. Scripts, we have them. Don't worry. You're going to start the beginning of your shift with COVID-19 updates, with on-the-fly training for your in-person volunteers, and you're going to teach them how to use the temporal thermometer every time. And then at the end of the shift, this is a new piece of the process. We want to formally get that feedback. We want to debrief from the people who are there in person. So again, we can continue to build our resources. Phone numbers, you're gonna have these, but this is pop-up technology. It's pretty lo-fi. Sometimes you show up for your shift, 10 minutes into your shift, if your shelter has not logged into the tablet, you can pick up the phone and give them a call. And I'll make sure you have these phone numbers. We do have a nurse disrupted phone number. We have tech support, which we're so excited about. But a funny thing, you see Bree's phone right now, everyone has my cell phone number. Be fearless. We need to make sure this program is working. And if all else fails, then you just give me a call, make sure that everything's taken care of. And then email, we have a general email, info@nurse disrupted. Okay. Here's just an overview of the beginning of your shift. You are going to provide education. It's what we do as nurses, right? Not always easy. Sometimes volunteers show up, maybe they haven't read their prep email, people might be all over the place, but we have a script. And again, the main thing is that that script will be renewed, okay? So keep your eyes on it. If you said something last night, might not be the same thing as this night. You should get a notification, but make sure you're familiar with what's been updated on the updates from the COVID-19 guidance. Again, we'll push that out to you. You don't have to do that research. Just be aware that night after night, that script might not be precisely the same. It's going to be updates. Screening requirements. So remember, when we started this program out, the CDC had 3 questions. It's up to 5. So you're going to continue to reinforce the coaching of your in-person volunteers of what the screening process is. How to use a temporal thermometer. It's a lot of variation in that. And again, we'll do more in-depth coaching on that, and proper use of PPE. If I see one more newscaster with their mask below their nose, I'm gonna do something. I don't know what, but just that PPE reinforcement is a big service that you can do. So you'll get a copy of the script, and Tracy is doing a video of how to do that script so that you have a lot of coaching and support and how to train the people who are there. Okay, so the beginning of the shift, we're changing to universal screening, where you will do screening on the in-person volunteers. And then we'll start with the universal screening of people who are there. The clients who are checking in. I got a little distracted. Now, what you're looking at right here is the test screening tool. And like I said, we've got the end-to-end protocol, but I want to show you what it's like to use this tool. And we're going to send you a version of it. And I just want you to practice with it until you feel comfortable, and give us feedback. If you feel like things should be different, or, that feedback is fantastic. So when you first use this tool, you're going to put in your email, and then here it gives you a little bit of in-time coaching, right? The first thing is when your client comes in, and even the volunteers, everyone have that mask on correctly. And this is branching logic. So if I say in this case, no, well then the tool will say, we need to make sure everyone has their mask on correctly. Whereas 25 to 30% of the clients come in without their mask on, or a natural tendency is that they pull it down because they see your face and they want you to see theirs. When I do the coaching, 100% of the clients have complied with the coaching. If people refuse to wear PPE, which I'll tell you, people thought there was going to be a lot of resistance. A new update for homeless shelters is that everybody has to wear cloth masks all the time. People thought this would be a big sticking point, but people have complied. So, for me, everyone, when I asked, put their mask on correctly. Notice I have a next button here. It'll bring me to the next part in the tool. Here's just some language coaching at first. My name is Bree Laughlin. I'm a volunteer here to screen you for COVID-19 symptoms only, and I will be asking you questions that are part of a protocol. I am not providing telemedicine services. This is a liability piece. We are screening only. We talked about that earlier, but we'll continue to reinforce that. You will not lose your bed. I forgot to talk about this. So talking about compassion, people are frightened. They don't know what to expect. They know everyone knows there's a pandemic going on, but reinforce too that no matter what, our guests are going to have a bed for the night. It might be in the shelter, but it might be in a hotel. So I always reassure them, you will not lose your bed for the night. We're just going to ask you some questions to help us understand the right place for you tonight. If you see that someone's wearing a hat, we need to remove it. That's for thermometers. The temporal thermometers don't work if you have a baseball hat on, or if you have any visible sweat. And then if they ask anything outside of screening questions, again, clarify. We're not working under our license. We're actually working as a lay volunteer, just using our nursing skills. And we only can answer questions or ask questions around COVID-19. And there's only one path. They indicate understanding and we move on. And then we start to use this tool for screening, and it supports, again, the questions that we're asking. The first thing that I get when I show people this tool, when I say, hey, have you had fever or chills? People say, well, aren't we just measuring their temperature? For those of you who live in Wisconsin, you know that we still are having nights that are under 30 degrees, where people are cold and they're waiting outside. So they'll come into the trailer and they'll warm up, and the thermometer will be more accurate. So first we ask, the initial questions. Now, the place where, we have this screening tool, the obvious piece I think that I'm going to state is, I've been so careful in saying apply the protocol, apply the protocol. Obviously, if you have someone in who can't get a breath in, who has blue lips, call 911. Anyone can do it. We haven't had that happen. But, it goes without saying, if you see someone just visibly struggling, um, these methodical questions, go to the side, the person goes to the ED, right? Okay, we're one or more above selected. Again, it's going to support the branching logic. Just use this tool a ton. And again, read, all of the questions. Here we do have where the evidence base comes from, whether it was the CDC or the Department of Health, and then again, guiding you through, assessing, is the patient, very sick? And in this case, were any of the above selected? Yes. And in this case, the protocol ends on, okay, we're going to activate the ED protocol. Your in-person volunteer is there. They're wearing a face shield. They have the full N95 mask. Hopefully the side of the client, they're the ones taking the thermometer. When there is a decision point in the protocol, they have a clipboard with the phone numbers. But I'll tell you, it is frightening for a non-medical person to do something like call the ED. And this is where, again, your nursing skills come into work, where you are saying, the ED protocol will be initiated, okay? And your in-person volunteer, and you can see this, will initiate the protocol. The in-person volunteer will call the ED. You will help coach them. The client's temperature was 103, and they have difficulty breathing. And based on that criteria, we are activating the ED protocol. So although my in-person volunteer is calling the ED, I've found that it is a lot of reinforcement that they are doing the right thing, to give them, again, the details as to why they screened in for this criteria. And that's true of the hotel protocol as well. Now, in the end, there's this opportunity to submit feedback. And so again, it doesn't have to be, just client specific or assessment specific. Anything you observed in this workflow is going to help us out a ton. Hit submit, and then you can start up another response for the next person that you complete screening on. That's just a small overview of what that tool looks like. Okay. Now I want to share this next screen with you. Okay. Okay, next. End of the shift. People will be eager to maybe go, but 8:30 the doors will close. Well, for the Porch Light, a little bit different. By 5:30, you'll have everyone through the door at Salvation Army. But for people who are in person, we'd like you to try and get some feedback from them. What worked? What could be improved? And we'll make sure that we have a nice little form, a Google form, where you can just put a note, a narrative there. Okay. Next steps. Going to that volunteer website. You can always get to the volunteer website from our general website, nursedisrupted.com. We have a link to our volunteer website there. So required paperwork, there's the Nurse Disrupted required paperwork. And then for each shelter, there's going to be additional paperwork when you sign up for that opportunity. Complete the training webinar. Congratulations, we're about at the end of that. And then the next piece is that before you can sign up for independent shifts, we have shifts with an experienced volunteer. So you'll get to see one do one. You'll see your experienced volunteer do the universal screening and the training, You'll be able to ask them questions. We think that's an important part of the process. But the volunteer, we know the volunteer site is a bit complex. We're here to help you with it. After this webinar, shift with an experienced volunteer is the opportunity that you're looking to respond to. And then once that's done, then you'll be able to self-sign up for shifts on the volunteer website. And just like that, we are at the end of this training. Thank you so much for your time. Don't hesitate to reach out with questions, info@nursedisrupted.com. You have my cell phone number now. But we really look forward to working with you, and thanks for all you do.